Are you finding it harder to read small print, use your phone, or focus on close-up tasks? If so, you're likely experiencing presbyopia, the age-related difficulty in focusing on near objects. But what if there was a simple, once-daily solution to bring that clarity back? Presbyopia is a natural part of aging, affecting nearly everyone over 40. It occurs when the eye's lens loses flexibility, making it difficult to adjust focus for near vision. This often leads to reaching for reading glasses. Uvezzi, carbachol, and brimonidine tartrate is a prescription eye drop designed to improve near vision in presbyopia. It offers a convenient, once-daily treatment to help you see close-up objects more clearly. This innovative eye drop works by creating a pinhole effect in your eye. By making your pupils smaller, Uvezzi allows only the most direct and focused light to enter, sharpening your vision, especially at close range. Uvezzi is a unique dual-agent eye drop, combining two active ingredients, carbachol and brimonidine tartrate. These work together to enhance your natural focusing ability. Carbachol, a cholinergic agent, is responsible for constricting the pupil. This pinhole effect is key to improving depth of focus, making close-up objects appear much clearer and more defined. Brimonidine, an alpha-adrenergic agonist, plays a crucial role in sustaining this effect. It helps prevent the pupil from widening again by relaxing opposing muscles in the iris, ensuring the constriction lasts longer. Together, these ingredients not only make the pupil smaller, but also engage the ciliary muscle. This supports accommodation and regulates pupil size, maintaining clear near vision throughout your day. Clinical trials have demonstrated Uvezzi's effectiveness. In the Phase 3 Brio-1 study, patients experienced improved near vision by 3 lines or more for up to 8 hours without needing glasses or contact lenses. Importantly, this improvement occurred without any loss of distance visual acuity. The usual dose of Uvezzi is 1 drop in each eye once a day. It begins working within 30 minutes, providing improved near vision that can last for up to 10 hours. For proper use, remove contact lenses before applying Uvezzi and wait 10 minutes before reinserting them. If you use other eye drops, administer them at least 5 minutes apart. Like all medications, Uvezzi can have side effects. Common ones include eye pain or irritation, blurry vision, and headache. Always discuss any concerns with your healthcare provider. Be aware that Uvezzi can make your vision blurry or darker, especially in low light. Do not drive or operate machinery if your vision is not clear, and exercise extra caution when driving at night. There's a rare risk of retinal problems, such as tears or detachment, associated with this type of medicine. If you suddenly see flashes of light, new floaters, or experience vision loss, seek immediate medical attention. Uvezzi is not recommended if you have eye inflammation, iritis. Use with caution if you have conditions related to poor blood circulation, such as depression, heart or brain circulation problems, or Raynaud's phenomenon. To prevent eye injury or infection, avoid touching the tip of the single-dose vial to your eye or any other surface. Do not use Uvezzi if you are allergic to carbachol, brimonidine tartrate, or any other ingredients. It's crucial to inform your doctor about all medications you are taking, as Uvezzi can interact with certain drugs. Uvezzi contains an ingredient that may lower blood pressure. If you take medicines for high blood pressure or certain heart medications, combining them with Uvezzi could increase the risk of low blood pressure. Your doctor may need to monitor you more closely. Uvezzi may also enhance the effects of medicines that cause drowsiness, such as alcohol, opiates, or sedatives. Using these together could lead to increased drowsiness or dizziness. Certain antidepressants, like tricyclic antidepressants, might alter how Uvezzi works in your body, potentially affecting its efficacy. MAO inhibitors, another type of antidepressant, could increase the risk of side effects like low blood pressure. Always use Uvezzi exactly as prescribed by your doctor. 1 single-dose vial is sufficient for both eyes. Discard the open vial and any remaining contents immediately after use to maintain sterility. Store Uvezzi at temperatures between 36 degrees Fahrenheit and 77 degrees Fahrenheit, which is about 2 degrees Celsius to 25 degrees Celsius. Once a pouch is opened, keep the single-dose vials in the foil pouch away from light until you are ready to use them. presbyopia doesn't have to limit your ability to enjoy life's close-up moments. Uvezzi offers a promising solution to help you regain clear near vision with a simple, once-daily eye drop. If you're tired of struggling with reading glasses and want to explore a new way to see clearly, talk to your eye care professional. Discuss if Uvezzi is the right choice for your presbyopia and take the first step towards sharper, more comfortable near vision.